Alrighty, I'll go ahead and just start with like a quick intro and then we can go ahead and get started. So thank you to everyone who's joining us for today's webinar. My name is Julie Norton and I'm the marketing coordinator for DESS USA. So we've had this PNP webinar series. It was 4 episodes spanning over the last 4 months. So today's episode will actually conclude that series as we touch on the final steps of the DESS PNP workflow. And then I'm excited to introduce our speakers for today. So today we have here Dr. Wendy Clark, who will be speaking on behalf of DESS. Wendy is a DESS key opinion leader and renowned prosthodontist and professor at UNC. So we're excited to have you here, Wendy. Also for the webinar, we've had an amazing partnership with VITA, and we have Jim McGuire, who is the Director of Technical Services and Repair for VITA North America. And Jim mentioned during our rehearsal that he could talk on this topic for 3 hours if needed. So I think that means he knows his stuff and we're going to learn something today. At the end of the webinar, we will have a Q&A session as well as a raffle giveaway. If you think of a question, feel free to drop it in the chat as we go along. And yeah, let's get started. Wendy, if you want to go ahead and kick us off and share your screen to present.
Hi, thank you so much for that wonderful introduction, Julie. I am super excited to speak on behalf of DESS today about the PNP, or the plug and play workflow, and excited to be at the end of the series. This has been a really exciting series, and if you missed any of the episodes, they are available on the DESS YouTube channel. All right. That's me. I am a DESS key opinion leader. I started working with DESS several years ago in my prosthodontic practice, and my favorite thing was they had a lot of different solutions for a lot of the complicated problems that I get to see in my practice, and they've just been a really fantastic partner for me as I take on some of these cases. So here's our rundown of where we are and where we started. So steps 1 through 5 were reviewed in the previous 3 webinars. And we'll kind of touch base on a little bit of those, but you can see that DESS has several different restorative solutions, from pre-milled blanks to angled bases to straight tie bases. And then you can roll into scanning with any scanner you want. And they reviewed some with the Medit scanner, which is fantastic, as well as laboratory scanners. Once you get the library, you can pull in those DESS parts and start your CAD design, mill those, and then you'll come to today, which is the exciting part for us restorative doctors, where we actually get to see the patients smile. And just to zoom in, here's where we are. We're cementing the structure. There can be many different structures. As we reviewed in the previous webinars, you might have a tie base, you might have a pre-milled blank, you might have a custom milled abutment, you might have a screw retained crown, you might have a cement retained crown. So this really covers all sorts of different restorative options. But the nice thing is that the FDA compliance part, which really prohibits a lot of labs from offering this option, has been taken care of with the DESS parts and the DESS protocol. So the FDA part is taken care of at that interface, and then the technician or the clinician, whoever's doing the milling and the design, is able to work on the above the platform, maintaining that FDA compliance. So today we will talk about bonding. Again, it's super compatible. There's many different options. We're keeping that FDA compliance, and this will kind of tie up that story. What I'd like to just start talking about is not only the simplicity, but also the versatility of this workflow. So if you watch the other 3 webinars, you'll see the different partners recommended for scanning, for milling, for design, and again today for the laboratory component, and they're all fantastic. And so if you're just getting started and you don't know where to start, this plug and play workflow gives you options on how to do that from A to Z, from start to finish. If you already have a scanner that you really like, or you already have a mill, or you already have a design software, and you're just looking to plug and play in those other pieces, those are options too. So as I go through some of the cases that I'm going to show, you'll see that sometimes I'm using a different design software, sometimes we're using a different abutment design, but all of those fit into this workflow. So it's simple because you can follow the plug and play step-by-step cookbook method, but it's also versatile where if you have something that you're really a fan of, whether it's a specific mill, a specific scanner, or a specific material, you can absolutely work that into your own PNP workflow. So this is my prosthodontic, something old, something new, something borrowed. It made me blue. And so you can see I was trained very conventionally. I finished dental school in 2007, which was the year that Bruxer was released. So I am as old as zirconia. And you see in this very analog case, we have an off-axis angulation. There's going to be a cantilever, trying to work through and solve those designs. Moving forward to my more digital age, we have a plethora of implant options here. So some were freshly placed, some had been there for decades, and we're trying to get everything in line. And historically, this was such a challenge with our conventional training where I was waxing up cast 2 abutments, taking conventional impressions, luting things together in the mouth with Duralay, and trying to get all of these things to align. Now, with these digital workflows, and particularly with a PNP workflow, there's compatibility across all of these implant abutments. I can pull them all into the same software, and it really simplifies from my end and from the laboratory end what we're able to do. So showing a few cases that we've done, we have a tie base with a custom zirconia abutment on top of it. So the interface, you can see as we go into the screw retain crown up here in the middle, the interface is still titanium, it's still machined, it's FDA compliant with the manufacturer's parts for numerous different implants, but we can custom design this abutment and the screw retain crown on top of it. Usually we'll do, here you can see there's a tie base with a substructure that was then layered, micro-layered on the facial. That's something that can certainly be milled out of zirconia, which Jim will do a fantastic job of talking about coming up. I really like the pre-milled blanks that I can then anodize to whatever color I want. So sometimes they're gold, sometimes they're pink, or you can leave them in a titanium shade. And you could do cement retained, screw retained, all sorts of options. So walking through kind of the middle of the protocol, if you go back to the previous webinars, step 4, you'll learn about CAD design. And here's where we're designing the zirconia portion of this custom abutment. Because of the screw access, this is going to be a cement retained crown. And so you see we do our abutment try-in, and then we go to our final crown here. And then on the radiograph, you can see where the titanium interface is lined up. The zirconia abutment and the Emax crown. Typically for cement retained cases, I always do a post-cementation x-ray to make sure there's no cement lurking around underneath the tissue. This is another case that we did with my colleague Ibrahim Dukum here at UNC. And again, we're designing not necessarily in the Exicad software, but certainly this could be done in Exicad, 3Shape, in lab, any sort of Blue Sky Bio, whatever Blender, whatever software you want, you can design your abutment and design your crown as long as you can pull in those DESS libraries. And then here we have custom milled blank, anodize the top portion gold, and then we design our crown and cement the 2 pieces together. So we're turning the separate crown and the separate custom abutment into a screw retained or screw mentable crown. And so this is showing the screw retained version of the restoration, which can then be carried to the mouth and placed as usual. And this one was one of the HT zirconia crowns, which VITA does a fantastic job of showing those. So again, just to summarize before we roll into the good stuff with Jim, the PNP workflow, simple, predictable. It takes away some of the guesswork that we get with the analog workflows that traumatized me as a young prosthodontist and dentist. And it also makes it easy to jump in and pull in whatever parts you want. Just kind of showing, I like to cement the parts outside the mouth. This is what Jim will be showing today with the access blocked and everything else. So here's a nice custom digital designed screw retained case for these missing laterals. And this is a 3-year recall. And this work was done with our in-house ceramist in Atlanta, Nigel Latren. So thank you for your time. I'm proud to represent DESS and all of their fantastic products. I'm happy if you have any questions for me specifically, I can answer those at the end, or you can email them to Julie if you think about them later. So thank you, everyone. I'll turn it over to Jim.
Thank you, Dr. Clark. I greatly appreciate it, and welcome everybody. Today we're going to go over some bonding, but we're also going to go over some other workflow that may be important to you regarding the zirconia abutments, titanium abutments, zirconia in general, and so forth. So let me share my screen here. So basically workflow integration of zirconia restorations. It covers a lot. I am Jim McGuire with VITA North America. We are an ownership with VITA Germany. My role is to help do training programs, technical support. I run the repair department as well. So the entire gamut of VITA products. So we're going to talk mainly about zirconia, titanium, and the workflow from about the time that you receive your abutment in, and then the selection of maybe subsequent restorative materials to cement. And that includes zirconia. We have a lot of zirconia on the market. VITA, of course, is not the only company that sells zirconia. It is something, though, that you should be kind of aware of on the types and what you're going to order if you're going to end up ordering or do chair-side zirconia as well as the abutments. So what's our indication for zirconia is just about everything we can do feldspar with. We can put it with frameworks, metal frameworks. We can attach it to titanium frameworks. We can bond it to just about anything today using specialized cementation techniques. There are people who do it on the inlays, onlays, veneers. I don't necessarily understand that from an aesthetic direction, only because there's so many other more natural lifelike products that can be produced to do, especially veneers and so forth. But of course, we can do crowns, bridges, all the way to a 14-unit bridge. We can place zirconia crowns over titanium abutments, zirconia abutments, and so forth. So it's kind of half and half. A lot of the design is going to be reliant on how you prep or how the actual CAD/CAM design is. If you're going through the DESS workflow, you still need to have adequate retention, for instance, especially if you're going to do cement retain. If you're going to do screw retain, it may not be as needed for the retention as long as we have a good bond. And with that good bond, it's going to last. So zirconia, if you're going to do a zirconia crown or a zirconia abutment, there are times that you're going to look at it and have to decide what degree of translucency is needed for that particular restoration. So if you have a titanium abutment, for instance, and you order a zirconia crown, if you get the very high translucent zirconia, you may end up where some of that grayish tint from the implant abutment is going to show through. So you want to make sure that you order a zirconia that masks out what's needed. Every time we increase the translucency, the more transparency there is as well. The more transparency, the more the effect from that prep is going to shine through your zirconia crown, especially if we thin out that zirconia crown enough where that you can have show through. So also with the higher translucency, we also increase the yttria and then decrease the strength as well. So what you use maybe for a single or a 3-unit or up to maybe a 4-unit bridge may be different than you're going to use for a full arch fixed restoration that you've had DESS produce a bar or some other type of full arch configuration that you're working with your lab on. So you have to keep in mind the zirconia that you order. There may be times that you're going to have to mix it up, where that you may end up having two different materials, restorative materials, to do different things, to mask out or to blend in. For in this case, you've got a very dark cervical prep on that left side, and you may need a different translucency of the material choice that you can use to cover that and still be able to blend in the crowns together, the restorative materials together, make the patient happy, get no dark, shadowing from the gingiva neck of that cervical neck of that restoration, or the implant itself showing through and providing a very gray tint to it. So we look at the zirconia itself. VITA, of course, like many other manufacturers, the VITA is very conscientious of making a very premium type zirconia. So when they do this, produce zirconia, which are in either disc form or block form, from your end, maybe it doesn't matter as long as you're receiving the restoration or the bridge. However, what it comes into play is whether or not that bridge fits, especially on implant cases, or you have deep margins where that you need to know that the zirconia is milled out, complete, sharp margins, fills in any deep tissue marginal area. And if it's a bridge, especially a full arch, that there's no warping within that material, so that you have a very passive fit, especially when it comes down to implant cases. Now, if you are doing chairside along with ordering your abutments from DESS or having DESS produce itself, if you do create the restorative crown, the full arch monolithic crown, for instance, you're also looking at making sure that the zirconia you have really doesn't chip. So you want to make sure that you have those sharp margins, and this is particularly true for implant cases, so that you don't have any cement, for instance, between that cervical crown implant abutment junction. So if you do mill some of your own restorative material that's made for your implant cases, make sure you maintain your milling units, make sure they're calibrated. Use sharp burrs. I know burrs are very expensive. That's why you have like DESS do it. They take care of all the milling for you if you have them do it, and they do a great job to produce very precise restorative materials and crowns and bridges. If you end up with, from the laboratory, for instance, you're going to have to maybe, or you do it chairside, you may or may not have to do some of the work on your own. You may have to modify it slightly. You're going to use a carbide burr, try to do everything dry if you want. There are plenty of zirconia green state burrs. You want to do everything, any adjustments, if you want to redo the anatomy, if you want to do recontour stuff, you want to do this more in the green state than in the sintered state, because it's really a tough situation when you start grinding on sintered zirconia. What you want to eventually do is get to the point where you can use rubber wheels and actually start polishing your zirconia. There's also these burrs that are Scotch-Brite. We usually use these in the laboratory side, usually use these for night guards to round out the edges and so forth. But these work really well on zirconia, and the zirconia itself is soft. It's in the green state, but it's dense enough where that you have a very precision polish, if you want, that once it's sintered, it shrinks to fit, and it is snug and sharp right at the margins. So these Scotch-Brite type wheels will smooth out the surface, smooth out those margins, and without chipping them. And then as you get down to the margins, just be careful that you don't slip and go inside, that you do damage the margins. However, they do a really nice job, because most of the time when we mill zirconia, the margins to mill out usually are a little bit thicker, and then after it's milled out in the green state, even for monolithic stuff, if you notice that there's a very thick margin, you want to remove that and thin those out before you sinter them. And then, of course, once they're smoothed out and you've got a nice surface, you're going to end up, after it's sintered, you're going to have less work to do. So again, if you're going to do some of your own work, chair side, we get a lot of calls that say, well, I've got this material from Katana, I've got this material from Ivoclar, I have this material from VITA, whoever it may be. I need to sinter it. Can I sinter it? Can I use the same sintering operation as all my other zirconia? The answer is no. Everything's made differently. The composition, even though they're all zirconia types, they have a composition in which do not sinter the exact same down to the same grain size from product to product. Because those grains, they have, during the sintering process, they shrink and they collapse, and they have to fit together correctly. And they all have different shrinkage rates, percentages. So at the optimal high temperature, that's where you have to follow the manufacturer's rules of sintering. So again, don't try to sinter everything using the same cycle that you normally do. Contact whoever you're working with, and if you have to sinter, go ahead and find out what that sintering parameter is. Now, the sintering itself is fairly easy. We have all sorts of sintering furnaces on the market. You may be using them as well. If not, they're sintered in the laboratory and sent to you. But again, the sintering cycle needs to be adjusted according to the shade, the zirconia material, whether they're pre-shaded or not, the size of the restoration, the material type, right? We're getting more and more into cubic zirconia that has a lot more higher translucency, a little bit more weaker, but you have to control that sintering. When you don't, things happen, things don't properly align as far as the grains as they shrink and produce the refraction, the reflection of light that's necessary. And this is the same material. However, one zirconia on the left-hand side was sintered using the wrong parameter. But then when you get them on track and you use the right parameter, then you have a true shade come out of it. After you receive any zirconia abutment, if you get it already sintered, if you're not doing it yourself, or if you're doing it yourself, as soon as it is sintered, you need to make sure that you treat the zirconia with respect, using the correct burrs and adjusting instrumentation. You're usually going to adjust it, if you have to, using the specific zirconia burrs and wheels, like dialite, for instance. Diamond burrs, try not to use a high speed. You try to use a lab handpiece, but if you can water cool it as you're adjusting it, the better, because you want to make sure that as you put your glaze on it, if it's a monolithic, that the glaze settles and fits seamlessly into the zirconia surface. So you're going to have a little bit more of a rough surface if you're going to glaze it. If you're just going to polish it, which a lot of zirconia today, a lot of the manufacturers are just saying you don't necessarily need to glaze your zirconia. Go ahead and just polish it. Again, if you just polish it, that's fine. VITA advocates that you polish it and glaze it, but you definitely need to always polish it so that when the patient is chewing, and if it does come into centric contact and functional, the opposing natural dentition is going to work on polished surface. Those grains, even though they're very small, microscopic, the grains are typically large enough, larger than the natural dentition tissue, and it will start wearing your natural dentition. So make sure it's polished. If you adjust after you seat, after you bond, you need to come back and polish it. Don't leave it rough for the patient. But there's many polishers available on the market specific for zirconia, and diamond burrs, rotary instruments specific for zirconia. Make sure that you use those dedicated for zirconia. If you're adjusting them, make sure again you're going to use low speed. It is possible that you can shock zirconia, monolithic zirconia, that if you're adjusting intraorally or outside the patient's mouth, if you're using too much pressure, too high RPM, you sense, just like a glass ceramic restorative material, you can shock it, even though zirconia is better at absorbing that shock. You can still cause it to microfracture, and you build up a lot of energy. So if you ever want to see what type of energy there is, you can take a zirconia crown, you can adjust it, turn off the lights, adjust it, and if sparks are flying, you know you're too high on the RPM, too much pressure, maybe a dull diamond burr. So make sure you adequately adjust for zirconia. Same with sandblasting. If you end up, part of the bonding protocol is you need to sandblast your restorations to have a little bit of micro texture for mechanical retention. If you've got your PSI, your bar high enough where that in the dark, you sandblast it and it sparks, you know you're too high in pressure, and you need to reduce it and be careful on that. If you do end up having to adjust your abutments, whether it's a zirconia and or a titanium abutment, if you're doing some of this stuff your own, if you're just ordering the blank from DESS, or if you're getting a partial contoured from DESS where they are pre-shaped, pre-milled at the factory, then you get it and you receive it and you try it in and it looks like it needs a little bit of adjustment here or there. Again, make sure you're using the right diamond burrs, the right contouring burrs. Make sure that your collars conform to the tissue development, that emergence profile. Make sure that you have adequate shoulder or a modified shoulder in which the zirconia crown or any other type of crown that you're putting on the abutment, it needs that shoulder to put all the pressure on, right? Because remember, the only seating area, the only contact area between your restorative crown and an implant abutment is that shoulder. Everywhere else has what we call a cement gap. So there's got to be enough room for the bonder, the composite resin, to sit without interfering with the seating of your restorative material crown onto that shoulder. So you need to follow the contour of your finished restorative shape with that collar if you end up adjusting that collar. If you're going to do cement retain, usually the minimal height is about 4 millimeters of abutment height to make it adequate. If not, if you don't have that, what you end up having to do is put some sort of slats, whether horizontal or vertical. Those slats will end up indexing your crown so that when you go to cement it, you can fit it back onto that abutment in the correct and a positive manner. Otherwise, once you get that bonder inside that crown and you try to push it on top of that abutment, if it's concentric and you can rotate it, you may not get the crown cemented in the proper position. An index or a slat will also help you provide buccal lingual orientation as well. So make sure you follow those manufacturer directions on your crown, on your implant abutment, so that you have the adequate retention, you're modifying it correctly. Again, carbide for titanium, carbide tungsten burrs are best utilized, but then you can start using some dedicated wheels as well. You want to smooth out your abutments, even though the pictures on the right-hand side show the retentive grooves. You still want to come back and you want to polish all the right-hand corners. If you're going to scan from that point, if you're going to seat the abutment, you've made it, you've had a customized abutment, you've adjusted it, you put some grooves, retentive grooves in it, horizontal, vertical. Make sure that before you scan it, you're going to have to block those out, because you can't mill or create a restoration that has those negative grooves in it, right? So you have to block that out, scan it, and then remove your blockout material, and then come back and bond your crown over the abutments and so forth. But make sure that you're adjusting your abutments correctly. Take your time. Titanium really is not a hard material to modify. In fact, it's a little bit less cumbersome than zirconia. Zirconia, you really got to be careful to use water cool when you adjust those zirconia abutments. So after you everything done, after you've got your implant abutment, you've got your zirconia crown or any other type of crown that's ready to be seated, bonded to your abutments, whether it's a zirconia abutment and or a titanium abutment. The crown itself, sometimes you're going to have to modify or characterize, right? So you have to learn and properly stain, glaze, restorative materials care side. Not always can the lab provide you with an ideal aesthetic crown for characterization unless you give them pictures, unless you give them more information than just a base shade. Because A3 to me is different than an A3 to somebody else. And they'll just make it like the shade guide, and maybe you've got some characterization that you need to add. So there are certain materials that you need to utilize for staining and glazing. Most companies produce what we call a universal stain and glaze. It's usually low, the ability to have to flash or glaze, to fire correctly, mature in a lower temperature, usually around 760 or degrees Celsius or above, and then has a CTE that's compatible with just about all the materials that are available. Ours is just one, again, the VITA material, staining glaze material. It's adjusted to fit onto metal, ceramics, on zirconia ceramics, on zirconia abutments that are pre-milled, and so forth. So just make sure you use a kind of a universal stain and glaze. One of the reasons why we always stain or glaze the zirconia especially is because zirconia typically is dead in UV light. It's usually dark. It's usually to a point in which it would be noticeable if your patient, if the goes to a party, goes to a nightclub and so forth. So you want to make sure that you ask your patients, hey, are you looking for a crown that you're also go out and you have a good time, which is great. So have a good time, but I need to know just to make sure that we cover you. to make sure that your fluorescence, the light interacts with your crown correctly so that they blend in, they look natural. So there are specialized glazes that you would use to modify your zirconia crowns or abutment. If it's a one piece and it's full contour monolithic, you need to make sure that you're glazing it correctly, staining it correctly with materials that are modified for higher fluorescence. And you pretty much can characterize it any way you want. Chair side if you want to, if you need to. Usually this is done in the lab or whoever does your final restoration, which is fantastic. Most labs do a great job to produce the shade and the characterization that you need, as long as you communicate correctly what those needs are. And then there's also, if you need to really quickly, if you adjust it, a glazed restoration of zirconia. If you need to, you can reglaze it, but that's why you need to learn how to glaze, how to stain things, and make sure that they look natural at the end of the day. There are even highly fluorescent glazes available at all. Again, this just happens to be a VITA product, but many of the manufacturers make different glazes for fluorescence. We typically, from the lab side, we use a powder liquid for the stains. Many clinics use paste. The pastes are a little bit more runnier. They're pre-made. You just got to make sure that you mix them correctly. If you're using the powder liquid, you just need to make sure that you mix it correctly, the powder liquid ratio, so that you have a nice edge with your brush when you apply it. You can apply the glaze and then stain. You can apply them together and fire it. You can apply your stain first, fire it, or you can glaze it. Or you might want to take your stain and mix it with the glaze and then apply it to your restoration. You're going to use whatever brush you feel comfortable with. There is no hard rules that you have to use number 0 brush, number 2 brush. Use whatever brush you are familiar with, that you feel comfortable with, that you can apply the glaze and the stains in the right place using it. You can sometimes use an endo file to drag the stains around through certain areas if you're going to reproduce stains and or maybe a crack on an anterior, a craze line. Just use an endo file and pull the stain across and then glaze on top of it. You're always going to want to start looking at what's needed, do the try-in. When you try it in and then you do all of your corrective stains, you then want to make sure that you clean your zirconia crowns correctly. Staining and glazing zirconia, you need to wet it first, and when you apply your glaze or your stain, make sure that you jam it in. You want to make sure that the glaze and the stains lay right on top of the zirconia. If you lightly brush it in, if you're not pushing a little bit, the glaze, the zirconia kind of resists laying that glaze down exactly on the material. So you want to push it in and then glaze it. And something that you need to make sure you do is not overbrush glaze in. You want to make sure that when you apply the glaze, you're done. Don't go back and start saying, oh, it looks like a little patch here, and this looks like more. And if you keep working on it, the glaze particles, what makes it flash, what makes it shiny, the glaze particles, you're going to end up, it feeds back into your brush, and then you're just left with a surface of the liquid. And so if it comes out matte or orange peel, it could be that you've just overworked the glaze. So make sure you don't do that, and then match it up to your shade guide if that's what you're trying to do. Just a note, You want to make sure that you're using the correct shade guides. Don't use an old one. Once old ones are beat up and they lose that natural gloss that the manufacturer fabricates on it, you can have the same shade, but they totally look different because of that. And anybody who's online who still has their old classical shade guide from the day that they graduated college, especially something that says lumen vacuum, I can tell you that these shades that we did once ago, they are completely different than what we do today. These are specialized tabs that were made out of a specialized porcelain, but we also added stains to the neck and the incisals. So a lot of us in the labs, we would actually have 3 of these, and we would grind off the necks on one, grind off on the incisal on another, and then have the complete set itself so that we could see just the shade without those stains. Glaze is very important. And when you're looking at a shade of a zirconia crown, you want to look at it with some wetness to it, either the glycerin, the liquid from your stain and glaze kit, or glaze it. But you have to look at your zirconia not in a matte finish. You have to look at it under a glazed finish, and then you can look and see if texture needs to be corrected, things of that nature. So whether it's glossed or not, same shade, they're going to look different depending on the light that you have. And then you're going to have to fire your crown restoration. Each restoration is fired to its own material type. So a lithium disilicate may not be fired the same temperature as a zirconia crown or a feldspathic ceramic material. Zirconia, we tend to fire at 850. In general, every zirconia can tolerate 850, even up to 950, to be honest with you, of firing the glaze at. But if you've got a glaze that only fires around 800, that might be what you have to do. But typically, we try to stick within the 850 range so that we can totally flash the glaze and make sure that there's the liquid itself is completely burnt out and it comes out correctly. We do not have to use a peg material or a putty material in zirconia crowns when we fire it. So you can just put them on a pin. If you need a little bit of peg or putty material to stabilize your crown or your bridge on the firing pins, no problem. You can do that for a good. What you want to avoid, though, is not following the rules, especially for zirconia. These are all customer pictures sent into us and say, hey, my crown, my zirconia crown, my restorative work, it comes out gray. It comes out with spots. One thing they all have in common is the fact that they didn't use the proper firing schedule for the glaze they were using. And typically you want to rush things. And when you rush them and you don't allow the liquid from the glaze material to totally dissipate, to gas off, if your crowns enter the hot chamber too quickly, as the gases are boiling off, as they're producing gas, there is some carbon in there, and the carbon actually gets frozen when the glaze becomes too hot, and it doesn't let the carbon gas expel out correctly. So make sure that you're using a slower pre-dry time, maybe a slower pre-dry temperature. Your temperature increase could be all the way down to 35 degrees if you're doing a very large bridge. We know that zirconia is a poor heat insulator. So if you don't slowly heat up your zirconia crowns in the furnace, and you allow the zirconia to heat up from the inside, If you're only heating really quickly the outside, it will freeze and cause issues with your glaze performance. So make sure you do that. Make sure that if you're have your own furnace, if you're doing some of this stuff, make sure it is clean. If you don't clean your furnace routinely, all the oxides, all the bad things that get fired in your furnace, instead of a clear window, these happen to be almost 20 different labs that we had produce from their furnaces, different window samples, and you can see the variation. It's impossible to get the correct shade if you're firing something and the glaze doesn't come out clear. You need to adjust that accordingly and clean it up. Every company makes them. Every company will have a silver test that you can adjust your furnace with as well, to just, if you think you have an older furnace, you're not sure if it is temperature calibrated correctly, you can get a silver test and just try that and calibrate your furnace so that it is at a zero balance on your firing schedule. So bonding itself, we at VITA, we don't, in the US, North American market, we don't sell our own cement, bonding cement. In Europe, they do, but we rely on other, even competitive companies, bonding systems, cementing systems. Every material itself may have different requirements for different cements. When we look at zirconia, we're looking at primarily glass ionomers for conventional cementation, not bonding. So this is usually, the glass ionomers are usually for a zirconia crown being cemented to a natural tooth, and you have also prepped that natural tooth with the correct 6-7 degree angle draft, if you will, on the axial walls to have that retention that's needed. It's almost like a PFM. On your zirconia to titanium, we use an adhesive material. We need to bond it. There's plenty of literature that recommends that you have a better bond if you use certain cements, bonding cements. And the reason is because zirconia, which does not have any glass filler, can't etch. So we have to use a different material to try to get that microscopic retention that's required. Now, there's a lot of different articles on bonding zirconia. The consensus today is generally to follow a method that you're comfortable with, but follow it according to most of the literature. And one of the first things we need to do is make sure that we clean the restoration and the titanium abutment. We need to have both of those free of any contamination, number one. There's plenty of cleaners on the market. VITA does not sell one. We do sell a hydrofluoric acid, an etchant for the ceramic crown, but we don't sell it today for the titanium abutment and or the zirconia material. We don't sell a primer for zirconia at this time. But the first part, and a lot of the literature suggests this, Dr. Blotz, Dr. Caneo, is a good example that they've done out of UPenn. They've done a lot of research on how to bond zirconia to titanium and get the best results. It's called the APC concept, but it's basically what we've been doing for years. We lightly sandblast the titanium abutment, slightly sandblast the inside of the zirconia. When you're sandblasting, you might want to make sure that you do two things. You stuff a little bit of cotton down the access chimney, in the chimney of your zirconia. Leave a little bit on the outside and the inside, but on the occlusal side, you can kind of cover that up at the very end. If it's screw retained, don't worry about it. But on the titanium abutment, you really need to cover the polished collar. Because remember, number one, periodontally, if you have a compromised implant abutment because of tissue, you have a lot of inflammation, and that's where a lot of implant abutments fail, is due to that. So I'll show you in a picture in a second, but go ahead and fill in your titanium abutment with a little cotton roll is fine. You can wax out your abutment collar. You can use a analog to connect it to, and then sandblast it. 1.5 2 bar, very light, 50 micron. If afterwards you need to sandblast a titanium abutment when you're all done, you can use glass beads. So that's very more wear kind friendly, if you will, and it won't roughen the surface. And then the next thing is to prime. You have to prime your implant abutment and your zirconia crown. There are some systems that all they'll do is prime the internal aspect of your zirconia crown, but you still have that sandblasted titanium abutment. If it requires it on your system, you need to prime it, the titanium abutment as well. But again, there's plenty of primers out there, bonders available. All the literature suggests that MDP-based primer yields the greatest strength when you're bonding zirconia restorations. So make sure you do that. And then, of course, use a composite resin cement. You may have to add it inside the crown, around the titanium abutment, and then make sure that when you squish them together, you firmly hold it down, kind of wiggle it on, and firmly hold it down onto the abutment all the way to that shoulder, and then start cleaning up any excess material. If you can do this with a screw retain outside the patient's mouth, that's the best method. Not always can we do that. Sometimes we have to do intraorally, but you got to make sure you're able to get back and clean that junction out completely free of any resin material, primer, and so forth. If you follow the rules correctly, generally speaking, the mode of fracture is going to be the screw, which is the weak link, which is where you want everything to fracture. If there's something going on with the patient, the bite's changing and so forth, you want to make sure that you have a cohesive, adhesive failure, and not just a cohesive failure or adhesive failure between your zirconia and your titanium abutment. If you see that, if it comes out clean on one side or the other, then either the zirconia needs to be etched properly with zirconia primer, and or the titanium abutment wasn't treated correctly. And then, of course, you've got your crowns. If it's screw retained, you have to come back, fill out your access chimneys. You're going to fill in maybe some cotton. Then you can use some gutta percha. You can use some Teflon tape. You can use something that will eventually at the top surface avoid any leakage, so that if you ever have to recover it, a cemented crown, you can pull the crown off and then retrieve that abutment without having to redo it. Screw retains a little bit more, takes more time, a little bit more issue as far as cosmetics. You want to make sure that before you fill in the composite, you put something on that screw access chimney in the above the screw head, because if you get cement or something or a composite crammed into that screw access channel of the screw head, you'll be difficult to retrieve. So throw something Teflon on it, and then go ahead and kind of etch the circular area of your access chimney, and then you can use a composite and light cure that together to make it more cosmetic. Again, if you don't get rid of your cement overflow, you're setting up to have a potential failure of that implant because of inflammation. So make sure your crowns fit well to your titanium abutment, especially the collar, and make sure you're able to go back and clean everything off as needed. Now, no matter which way you do it, whether screw retain or cement retain, what the crown is, you still have the ability to create, after the implant's placed, to work with as a team to make sure the implant's placed actually correct, and then make sure that that abutment and zirconia abutment, or whatever combination you have, it's got the right natural profile. It fits the form, the shape, the socket, and maybe sometimes you may have to do a zirconia to zirconia restoration to block out the access channels using the primary substructure of zirconia, and then come back and bond a bridge, a superstructure bridge over the zirconia substructure that's connected to implants. But no matter which way you do it, we also recognize that a partner like DESS, who will provide you with the FDA controlled correct abutment to the design that you want, is a partner that you want to work with and make sure that you successfully provide them the right information, and they'll provide you with the needed materials that they'll provide you for a successful smile. So DESS is a really nice company to work with. I want to thank Julie and Dr. Clark on your presentation and allowing me to spend a few minutes here to talk to you. If you have any questions, certainly we can pick those up. Just want to remind everyone there is a raffle. Julie, I think you are going to talk about that. I'll stop. I can either keep sharing or not. Julie?
All right. You can go ahead and stop sharing if you want, Jim.
All right.
Awesome. Thank you so much, Jim. Yeah, thank you both, Dr. Clark and Jim, for sharing your expertise today. So we really appreciate you taking your time and knowledge to share all this helpful information and tips with us. We do have like a minute or so. Does anyone have any questions that they either want to drop in the chat or tell us right now? All right. If you do think of any, feel free to either email DESS or VITA. You can always make your subject line the PNP Workflow Webinar and just let us know if you had any questions that came up. So we'll go ahead and announce our raffle winners now. So we just chose 2 raffle winners at random. If you're a winner, we're going to email you after the webinar today to let you know. And we do have a DESS winner and a VITA winner. The DESS prize is a $250 store credit, and the VITA prize is a product pack. I know Jim had it on his screen for a moment there, so a really great giveaway. So our DESS winner is Daniel Morano, and the winner of the VITA prize pack is Lumiere Dental Arts. So check your inbox. We'll send you both an email. And everyone else, thank you so much for joining us. We'll make sure we get this webinar recording up on our YouTube channel if you want to watch again. And everyone, have a great day. All right.
Bye, everybody.
Thank you. Thank you both.
Thanks for joining
Bye,
us.
everyone.